Viewers, welcome to another episode of Intimate Conversations with Isa Favored. We live in a time of load shedding. So today, the conversation we're supposed to have was supposed to be a very long. However, due to load shedding, we're going to do an introduction today, and we'll try and have a follow-up on it. And you know, when we grow up as an individual, you are born, you grow up, we have dreams, we have aspirations that one day I'm going to be a parent. And when you get older, and you are ready for that time when you're thinking, I'm ready now to be a parent, life happens, you find that it is not possible. And maybe then your doctors are going to tell you that there is infertility issues and all that. So that's what we're going to be talking about today. And you know that I'm not an expert in this issue, so I always look for experts who are going to come and try and unpack it for us. So I have a very well-known doctor in Nelspruit. So if you're in Nelspruit and you don't know her, something is not right. You gotta know her. I've got Dr Lerato Khoele, who is a gynecologist, and she says obstetrician gynecologist. I even don't want to go there because of time. Welcome, doctor.
Thank you for having me.
And thank you for agreeing to be a guest on our show.
Only a pleasure.
Yes. So let's try and unpack infertility. As I said, that you will then be the ones that break the not so good news to either a person or a couple who are trying. And at what point do we call, maybe let's define what is infertility medically.
Infertility is failure to conceive, to fall pregnant after trying for a year, especially for people who are less than 35 years. If you've had regular intercourse and pregnancy hasn't happened after a year, then we can say the couple is infertile. Or if it's been more than 6 months and you are more than 35 years of age, then we'd advise one to seek help and see why are they not falling pregnant.
Okay. So for under 35, it's 12 years of regular. I don't even want to define regular.
12 months, yes.
12 months of regular intercourse,
yes.
And then you don't fall pregnant, then you will then be called infertile.
Yes, okay. Yes.
And then I also know, I tried to do a bit of research, that we've got what we call primary and secondary infertility.
Yes.
Okay.
So primary infertility is when that you've never fallen pregnant, you've never had a miscarriage, you've never had an abortion. So that is primary infertility. Okay. Secondary infertility, you've either had a miscarriage, you have fallen pregnant before, you have a child, but now you're not falling pregnant. Then that we call secondary infertility.
Okay.
Yes.
All right. What are the causes? What are the causes? Maybe, because I wanted to say, could it be genes, could it be what, but maybe you can then explain it to us. What causes infertility?
Infertility, we classify it as, we'll say 32% is female factors or 32% is male factors. The other percentages, we don't know the cause. We both are fine. We haven't found any reason why we're not falling pregnant, but it's just not happening. And there isn't a medical reason of why it's not happening. With regards to female factor, we start off, we look at the ovaries. Inside the ovaries, we have our eggs. It could be the eggs are finished before you are 51 years of age, meaning you've reached menopause at about the age of 30, before 51 and a half years of age.
Let's pause and talk about the eggs and eggs finishing.
Yes.
Because generally, you will start your periods at a particular age, 12, 13, 14.
Yes.
So does it mean an individual has got a number of eggs?
Yes.
Let's just unpack
exactly.
that.
So when we're born as a girl, you're born with all your eggs. So if you are going to get 5 million eggs, you're going to get 50 eggs. Those are all your eggs you are born with. From the age of 12, you start losing the eggs when you ovulate. So when you release an egg, you're losing that egg. Next month, when you ovulate again, you lose an egg.
So each month is 1 month, 1 egg?
You could be 1 or you could lose 2. So
Okay.
yes, so you lose eggs every month when you ovulate. So by the age of 51 and a half, the textbooks say that all the eggs should be finished around about then. That's when menopause kicks in. So some people, when they are less than the 51 and a half, the eggs are finished. I didn't, as a person, you didn't know that your eggs are finished. You don't see your periods. You start having symptoms of menopause at about the age of 30, and then that we call premature ovarian failure. Your ovaries are failing prematurely before the time. Yes.
So that could be the one cause then of infertility
That
in
could
females.
Yes, that could be one of the causes, or the other cause could be what we call PCOS, polycystic ovarian syndrome, where you have many cysts in your ovary, and then we don't ovulate, we don't release a mature egg, then we don't fall pregnant.
So, okay, on the one of cysts, the person will still have periods,
Yes.
but they are not matured.
Yes. So either you skip months where you see like 3 months you don't see your periods and then the period comes, or you see your period but it comes after 35 days. So it's a prolonged time when it doesn't come when it should be coming at 28 days, but yours comes like 35 days. So it's irregular periods that can cause. You see people who have almost like hair, like male distribution, we have acne. So we start diagnosing things like polycystic ovarian syndrome. That can cause difficulty falling pregnant because you release an immature egg. You don't release a mature egg that the sperm will meet and fertilize to make a baby.
And there's nothing that a person can do in that instance, more especially on this one, or there's medication that a person can
there's
take.
something that can be done.
Okay,
Yes.
so we'll come there.
Yes.
We'll come to. So
Yes.
we've mentioned the ovarian and
Cystic ovarian, yes.
This technical.
PCOS.
PCOS,
Yes.
So the cysts, is it growths or what?
It's
is
just
the-
like a blister. A cyst is like when you burn, you get like a boil, you pop it. So all of us inside our ovaries, we have a couple of those boils. Inside the boils, there's an egg. So every month the boil must grow so that the egg inside matures.
Okay.
Then it pops. That's when we ovulate. As it pops, that fluid pushes the egg in the tube, and then the sperm meets the egg in the tube.
Okay.
To fertilize.
to fertilize, then you're pregnant.
Yes.
Okay. And then any other reason?
So pretty much those are the main ones in the ovary. And then the next one is the tubes.
Okay.
The tubes, because the tube is where the egg and the sperm meet. So when you ovulate, when the egg it comes in the tube, the sperm comes through the vagina into the uterus, into the tube, and it meets the egg in the tube, and they come together in the tube. The tube moves this combination inside the uterus, and then the baby grows in there.
Okay.
So if the tube is blocked, the egg will pop, but the sperm will come, there's nobody home, there's no egg. Then we don't fall pregnant, we menstruate. Next month again, the egg will pop, but it doesn't get in the tube because it's blocked. The sperm will come, nobody's home, no pregnancy.
Okay. So it will still pop.
Yes.
It's just what causes the blockage?
Blockage, a lot of the times, mostly it's mainly infection. When one has had infections over the years, sexually transmitted infections, even this thing called endometriosis, that can cause. Yes.
We'll come to that.
So that can also cause blockage of the tubes as well.
Oh, okay.
Yes.
All right. Let's talk a little bit so that because we also want to educate. So when somebody has an STI,
Yes.
you have unprotected sex,
Yes.
it is critical then to treat.
Yes.
Because it can lead to
Infertility.
infertility.
Yes.
Just a bit, how will one know that they've got an STI?
Unfortunately, one gets discharge that is smelling, that is not being treated by normal medication that we may give, then we need proper antibiotics.
Okay.
Yes. Then, unfortunately, the other way is as we test, we take a sample of your discharge and we send it away, and that gets analyzed, and then it says you've got chlamydia. Then we treat you for that.
For that.
Yes.
So it's possible that a person could have had chlamydia and they got treatment, and then it might not lead then to
Yes.
tube blockage.
Yes. Yes.
Okay.
Yes.
I guess then viewers at home, what then becomes critical is to say, if you ever find yourself with a discharge that is not normal, don't take it lightly.
Yes.
Because if you take it lightly, then you run the risk of a future problem.
Yes, that is true. Yes.
Okay.
Yeah.
So let's talk endometriosis.
Sure.
Did I say it correctly?
Yes, yes.
Okay.
Sure, that's a mouthful.
It is.
Yes.
It is.
Endometriosis, sure. Endometriosis is what happens is that, okay, normally what happens inside your uterus when you shed, what makes the lining thick, it's the estrogen hormone when you ovulate. It makes the lining of the uterus thick, getting ready for a baby. If no baby happens, you shed that lining. It's not an egg coming out. Okay. It's you shedding that lining. Next month again, the lining gets thick when you ovulate. No pregnancy, you shed. With endometriosis, that blood that comes through the vagina comes out through the tubes and then it falls inside your abdomen. Some of it comes out through the vagina, some of it falls through the tubes, and then it falls inside and causes an inflammation. So anything in medical term that says that has an is at the end means inflammation, tonsillitis, otitis, appendicitis, endometriosis, so meaning there's an inflammation. So that blood that has fallen in the abdomen causes, it's painful, it causes inflammation, it's like, it's angry, it's pain.
Because it's not supposed to be there.
It shouldn't be
there.
there.
It was supposed to all go here.
Through the vagina.
So it went...
Through the tubes, and then it caused an inflammation inside.
Okay.
Yes.
So the blood, does it stay there, or the one that came, does it
stays in your abdomen. So next month
it packs,
yes,
it kind of packs up, for lack of a better word.
Yes, it keeps collecting, and that can cause infertility. It can cause severe pain during intercourse. One has pain when you do number one, number two. It can cause severe pain. So that's endometriosis in a nutshell.
In trying to simplify it.
That's it. Yes.
Okay.
Yes.
And then you have what I know that growing up, and actually I know it's your Sotho, you may not know it in Sotho, but you have, remember when you're growing up, if you've got period pains, then people will say uneslumo. I don't know, I'm sure you've heard it since you got here, but uneslumo, and slumo might mean you might not have children and all that. What causes those period pains where people go really? What is happening?
Endometriosis is the blood that falls through when it falls in the abdomen. It causes inflammation, it's pain. So it causes pain, period pains. Even when the uterus contracts to take out the blood during menstruation, it's contracting. So it's pushing the blood out, that causes pain as well.
Okay.
Yes.
Sometimes then you have people that have clots during their periods. What is that?
It's just, clotting is that it's just a lot of blood that has come together, and as it comes together, it makes a clot. Then it becomes heavy, it falls, and then you just see this big clot.
Oh, okay.
And one of the other reasons that could cause infertility would be like things like growths inside the uterus, that like things like fibroids that can cause a lot of bleeding, that can cause a lot of blood to come together and clot, and you just see that you bleed a lot.
A lot.
Yes.
And
yes.
some find that it takes too long, many days of
bleeding. Yes, yes. So those are the main things really of causing infertility. So when we talk about ovarian problems, we talk about tubal problems, we talk about the uterus itself.
Okay.
And there's something that can be done for most of the things. Something can be done. Okay. And that is the female factor. Even the man, we look at their sperm. We look at the shape of the sperm. We look at the number of sperm, because around one egg, we need over 39 million sperm. So if one has 2 million sperm, 3 million sperm, it's not as the number that we would like around one egg.
They say it takes one sperm to fertilize. Why do we need so many around the egg?
Because it's a long way to go to get to the egg. It's a long way to go, and now we are competing for this egg. Okay. So you know that you are that one that made it from that 39 million.
That's running to get to the egg.
That's it.
Okay.
Yes.
So in essence, you or even though it's only one that will fertilize,
Yes.
there must be a lot of them that
That
try
go
to
there.
that go there.
Yes. So we look at the number, we look at the shape, we look at the movement because they must move to get to the tube. So those are the things that we look at. But if there's a problem with any of those things, something can always be done. So
Okay.
if we start with the ladies, let's start with if there's a problem with the ovaries. Unfortunately, if you've had premature ovarian failure, your ovaries are not making eggs anymore, they are finished, meaning you've reached menopause at 30, kind of thing.
Yes.
Then unfortunately you need an egg donor. So, and your eggs will be, somebody will donate their eggs, we will mix it with your husband's sperm, put it together, then put it back inside of me. Then I carry the pregnancy. That's my baby. That's
it
an
your-
egg donor. Yes, ma'am.
It's your-
It's my
Okay,
pregnancy.
my
It's
my head now goes.
Yes.
The only donation is the egg,
Yes.
but then because I've carried it, it's my
It's
baby.
mine. It's mine. Yes.
Okay.
So that's when you have a problem now with premature ovarian failure. If the problem is polycystic ovarian syndrome, there's medication we can give you, quite a bit. There's quite a lot of medication. We give you, you can fall pregnant.
Okay.
Yeah. If the problem is the tubes, unfortunately, we have to do this in vitro fertilization because the meeting area is not right.
It's not right.
So where the egg and sperm normally meet is not working. But my eggs are fine. My uterus is fine. The problem are my tubes.
The pathway.
That's it. So they take my husband's sperm, then we put a needle in, we pull out my eggs, we mix my eggs with my husband's sperm outside. Once they come together, they put it back inside of me. And then I fall pregnant.
I know that with that,
Yes.
there's a friend of mine had a child through IVF.
Yes.
And I remember she calls me one day. She's like, I think my egg that's lying there, it's time we go. We know we do something about it. She went, they tried, and then there's something. It's possible that it doesn't
Attach.
Yes.
Yes.
Okay.
So it's possible that once we try putting it back in, it doesn't attach. Then it's a failure. So we try again. So if the problem is the uterus, if I've got growths that we can remove for us to fall pregnant, then we operate, remove the growths, then we fall pregnant the normal way. Sometimes I have a problem that there's this thing called adenomyosis, which is another topic, where the blood goes into the muscle of the uterus. My uterus now nothing can live in my uterus. That means my uterus cannot carry a baby. Then that's when we talk about surrogacy, where we get another person who offers that they will carry my pregnancy for us. So my husband's sperm, we mix it with my eggs outside, and then we put it inside somebody else who carries it for me. And then that's my baby. Sure, mouthful.
The baby story is like someone's egg in you, my baby, my egg in someone, my baby.
Yes.
And I think I would like, as I said, that we press for time, but I would also like, because you highlighted that when we get to surrogacy, because what happens when the lining of the uterus? You said?
The lining of the uterus gets thick. That's where, and then the pregnancy implants in that way it's thick, where the nutrients are, the vitamins are. If no pregnancy happens, that lining sheds. That's menstruation.
Yeah. Now, when you were speaking about where we'll end up doing surrogacy, because blood will have been on the lining of the uterus.
In the muscle of the uterus. So the uterus now is just a mess that doesn't work. So nothing can implant in that uterus. So my uterus is non-functional. So then somebody else's uterus that is still young can still carry the pregnancy for me. Just like things like Union. What's her name? Gabriel
Union.
She had adenomyosis. Okay. So that's why they took her eggs, mixed it with her husband. Somebody else carried for her. Yes, and it's their baby.
Okay. I would love for us to talk about that some other day.
Yes.
In terms of the psychological aspects to it.
Yes.
Because you will have dealt with patients.
Yes.
I'm sure there's some psychological aspects that are attached to that.
Yes.
Also from the bonding with the child and all that. Topic not for today.
Yes. Yes.
For another day.
Yes.
One of the things when I was just reading up, I also had this healthy eggs and unhealthy eggs.
Yes. Yes. So if now I'm trying to do in vitro fertilization, then we pull out my eggs, and then we mix them with my husband's sperm, but it doesn't come together. The egg and sperm just don't make sense together. Then the pregnancy doesn't happen. Oh yeah, I wanted to say as well, if the problem is the sperm, either the numbers or the movement, they're not moving fast, or the shape, we can do as well what we call ICSI. ICSI, what happens is that my eggs, everything of mine is fine. The problem is the sperm. So we pull out my eggs, and then we take the 100 sperm that my husband has.
That are not.
Yeah, no, he's got 100. He only has
Okay.
100. So we look under the microscope for a good one. Then we see a good looking one out of that 100. We inject it directly into the egg. Then we take and we look for another sperm, inject it in another egg, inject another one. Once they start dividing nicely, we put it back inside of me.
All of them, or you put one?
Well, it depends on how many eggs we've got.
Okay.
So let's just say we had 4 eggs. We put 4 sperms, and then if I'm less than 35, we only put 2 in, what we call embryos that have come together.
Yes.
If you're more than 35, we put 3.
Okay.
And then we wait and see what will attach.
So, and if all attached, then you've got
Yes,
triplets.
that's it.
Oh my goodness.
Yes, ma'am. Yes, ma'am. Yes,
I'm sure that
ma'am.
will be beautiful when you've been trying for so long.
But we don't like it. As gynaes don't like having you with multiples because it's drama. It causes stress because one twin or one triplet could be eating one's food and what. So it's yeah. But for you, you would be excited. For us, we're like,
You're holding until the
Yes.
last day when the babies come. Then you're like, finally they are here. They all survived.
That's it.
Okay.
Yes.
As I indicated that today we're going to do intro.
Yes.
Time, load shedding, I've just been told that we left 5 minutes. We need to work towards wrap up
Yes.
because of load shedding. But what are your, as we were introduced, and I take that you are so that we can unpack. Today we're rushing through this because
Yes.
as you come back, you highlighted that you also do female, what did you call it? What is the word?
Aesthetic gynecology.
Aesthetic gynecologist.
Yes.
Ladies,
Yes.
you must make sure that you tune in when we do this next one. But then, and we'll also just enlarge a bit on the issues of infertility that we may not have been able to touch on today.
Yes.
What will be your parting thoughts to somebody at home who is struggling
Yes.
with conceiving? What will be your parting shots?
The main thing is that it's not taboo. It's not taboo and we should talk about it. We shouldn't be afraid to talk about the struggles of falling pregnant. There's a lot of us who are struggling. There's a lot of us who struggled to fall pregnant. And if you are struggling, do seek help. I mean, there is help out there. We are there to come help you. Catalia Fertility Center, we are there. So really, there is always something that can be done. And even if it's a man and he has absolutely no sperm, and we also get sperm donors. So there is so many things that can be done. And it's not always just the female factors that causes us not to fall pregnant. It's also male factors. And for our men, especially our black men, it's always the ego, the taboo, you can't talk, I'm the man. And if now we have to get a sperm donor, you feel like it's not my child. In the meantime, this is our struggle together. Yes.
Okay. Viewers, we've had to do a marathon because of the times we're living in. But thank you for tuning in. And like I said, we're just introducing. We're still going to have Dr. Lerato come. I know I've put her under the spotlight to confirm, but yes, she's definitely going to come back and we're going to try and unpack these things more because we are about educating and we are about making sure that we don't struggle when help is available. And most of the time, when you find or when you hear talks about inyumba in Siswati, it's women who actually insult other women who cannot fall pregnant. In the families, the in-laws are the ones that will be talking about the woman as if she's the only one who struggles. We understand that infertility can be both male and female, the factors that are contributing to that. So when we find ourselves in that situation, let us just make sure that we are kind. Let us also be caring because most people desire to have a child of their own. And even if they will do it through IVF or surrogacy, it still remains their child. So let us be wise, let us be educated as a nation so that we together then build a better society and a better nation. Thank you for tuning in. We shall touch base on this topic again so that we make sure that we empower and educate you even more. Remember to subscribe. If you haven't subscribed, remember to subscribe and click on that notification button so that when we post new content, you are able to get the content. Thank you for tuning in. Until next time, take care.